Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant slash associate and health educator. So today I'm going to talk about a conversation I had with one of my PA mentors. He's almost 80 years old and he's one of the pioneers. He became a PA back in like 1970. He's retired now, but we were talking about the different generations of people and how they represent the PA field. He's from the pioneers, some of the original PAs. I'm from maybe years after that. So I've been a PA for more than 20 years now. So I graduated in 2000. So I represent the Generation Xers, I guess you could say, for those PAs that came in. There's very young PAs who are millennials and some Generation Zers. And I think with each generation, there are some challenges. One of the challenges that we were discussing was the younger generation of PAs and some of the demands they have. For example, and this may not be indicative of a particular generation, but I found it to be the case based on my observation and working with them. So the younger generation is more demanding, I found, in terms of what they get for salary and the where they work and the conditions of their work in which they're working, their contracts and things like that. Not that they're spoiled, but it's just what PAs get now is more than what PAs from my generation got, and certainly more than what PAs from the pioneers generation got. You can expect to get a salary of over $100,000 a year with no experience. You can expect that. That's life-changing money. When you're in your early 20s and you just graduated from PA school, you'll be able to move out of your parents' basement. Thanks. Unlike some of your schoolmates who may have majored in fine arts. You don't have to work. You're not going to have to work waiting tables or anything until you get that big break, because you got a BFA or an MFA in writing or drama or history. So being a PA is a great job. It's the number one job in America according to U.S. News and World Report. You go onto the Bureau of Labor and Statistics website. You see how much PAs make. So there's an expectation that young PAs have that those of us that have been in it for a while can say, look, I remember my first job. I got $56,000 per year, and I was so happy to get that. Then I was working, I got invited to be on the staff of my alma mater, Howard University. I was brought on as adjunct faculty for $24,000. So I was making a whopping $80,000 a year. And I was like, wow, that's big money. Felt like one of these rappers or something, big money. But I remember when I was going to leave my job, because I got a better offer elsewhere after several years of working there, and I was coming to some of the students I had talked to whom I had taught. I said, look, you want to take over for me at this nonprofit clinic? Like, what does it pay? Well, I think it pays like 70. You could see if you can make 70 grand a year. No, 70. I'm gonna make it 70. This was back in 2005, 2006. They wanted like 100,000. I said, it doesn't pay 100,000. It's a nonprofit clinic. But these were much younger folks. But that's how it is. So I say that as a caveat to the younger generation of PAs coming in, just to proceed with caution, because there's already talk. There's people questioning whether or not the PA field is saturated with PAs. In some areas it is. Hey there.
So now they're finally gonna...
In some areas it is, depending on where you're trying to work. And some places don't want to hire PAs because of reimbursement issues. You know, if, for example, if a hospital sees patients, most of them have insurance X, and insurance X says, look, we don't reimburse for PA services. We'll reimburse 100% for MD and at least 90% for NP, 90 to 100% for NPs, nurse practitioners, but we're not going to do that for PAs. So that's a place where you will not get hired, unless maybe a doctor wants to bring you on to help them out, you know, when he or she are not in the clinic, and they can pay you out of their pocket. I've seen that done with PAs before. So with the new generation, there's got to be some new challenges, I think. So I would say to the younger guys, just be patient and try to be smart with this career. Being a PA is a great career. Get something to augment being a PA. I'm so proud and impressed by these young PAs that they got their YouTube channels that are well organized, much better organized than mine. This is just a vlog. I'm spouting my 2 cents, but they're very organized. They're teaching classes online. So there's a lot you can do in conjunction with your PA degree. I think that the pioneer generation they understood that that the field was started for a different it was a different paradigm. It was like, okay, you're here to help the doctor, and in some cases, many cases, that's what we PAs still do, but we see ourselves as working in conjunction with the doctors. Doctors have called me their colleague. That's humbling to me, because I'm like, well, I'm a PA. I have 1/4 year training, but they see me as a colleague. Many of the MDs with whom I work, but I try to keep things in perspective and understanding that I'm not a MD. You don't want to price yourself out of a job or out of our careers. I've heard PAs say, look, if the doctors are getting 130 an hour, we should be making 100 an hour. No, I disagree with that. You know, you gotta be humble, take what you're getting, take what you can get for the time being, get good job skills together, and you can always supplement your income working elsewhere. That's the beauty of being a PA. You know, you can work as a hospitalist, you know, 3 days a week for 12-hour shifts, and then moonlight at the local inner city hospital in the ER, which you get, you know, that'll augment your skills. Or you can even, there's a group that does online, that does telemedicine. You can do that. But that's it for now. I rambling and running. But I wish you guys the best of success in your positive endeavors. If you want to reach out to me, I'll put my contact information in the description. For those of you guys that are just graduating and just embarking upon that new job, congratulations. I hope you have a long, illustrious career, even better than mine. You know, it's a great profession. Take care. Peace.